we also need that inclusion when we are at national level to say, can you include us as the trans identifying people when we are making policies which will also affect our lives? So it's one of the things that we are trying to push within the government and within the National AIDS Council and the Ministry of Health, the inclusion to say, don't speak on our behalf, don't discriminate us, but actually, can you involve us at national level so that we can also put our challenges on the table and see how we can work together to improve our lives.
Stick Your Neck Out, the weekly podcast of the Giraffe Heroes Foundation.
By law, when you are born, your birth certificate must specify your gender. This dictates how you are affected by things like pensions and marriages that fall under the state's scope. Unfortunately, this law applies only if you fit into the female-male binary. Welcome to the podcast to restore your faith in humanity. Welcome to Stick Your Neck Out. When we use the word transgender, we are referring to an inclusive umbrella term that consists of binary trans people, trans men and trans women, as well as non-binary people and people who cross-dress. There are a lot of ways that transgender people can describe their identities. Understanding the words and labels people use encourages respect. 3 out of 5 African countries have laws criminalizing homosexuality and the public expression of sexual or gender behavior that does not conform with heterosexual norms. These same laws even sometimes punish LGBTQI rights advocacy. My guest today comes from one of these countries, Zimbabwe. Welcome, Kantari alumni Gumisayi Bonzo.
Hi, welcome everyone.
Gumisayi Bonzo started working with HIV-positive women in prisons after being in prison for 2 months. Gumisayi is also executive director at Zimbabwe Mighty Women of Hope support organization. She also works with sex workers in the Avenues area in Harare. Gumisayi, that sounds like a lot of activities in the women empowerment field, isn't it?
Yeah, it is. But if we have the passion, then it's much easier.
Yeah, that's right. Above all this work in the field of women empowerment, you also founded 2012 the Trans Smart Trust, an organization focused on intersex and transgender. But you managed to register it only 4 years later. Why was it so difficult to register it as a trust?
So in Zimbabwe, it's very difficult to register an organization working with the LGBT community because of the social norms, and our government does not allow, because normally they say you are promoting homosexuality or gay people and lesbians. For us, it was like we were working with the transgender and intersex community, but in Zimbabwe, everyone is heaped under gays and lesbians. So they didn't actually understand if someone is born a transgender, what does it mean? The scientific evidence which is there. If someone is born in intersex, the scientific evidence which is there to say it's not by choice, but that this is who that person is. So even the judges, even the registrar general, where you get your identity cards, they don't understand that. What they actually do is just they look at you. If you have a penis, then you are a man. If you have a vagina, you are classified as a woman. So it was very difficult then to actually change our vision, even our objectives, to say we want our government to actually acknowledge that there are people in Zimbabwe who are born as transgender or intersex.
I see. So how do you manage to register it at all?
Okay, so for Transmart, we used the entry point of Healthy, where you were looking at HIV, and we used that as an entry point to say, if we want to end HIV, we must not leave anyone behind in this fight against HIV.
That's right.
So we then said, as the transgender and intersex, it's one of the key populations which are affected by HIV. Even in Zimbabwe, where we're saying we have sex workers as a key population, we have men who have sex as a key population, and then we said we also have transgender and intersex as key populations, and we want it to be a stand-alone key population when we were in the Ministry of Health field. So this is how we then managed to get through. We used the HIV as an entry point.
So Transmart Trust works to promote the identification, inclusion, integration and assimilation of human rights issues affecting intersex and transgender persons within different social groups of the larger Zimbabwean community.
Exactly.
How can I and our listeners to get a picture of how exactly you are doing that?
Okay, so there were so many exclusion from policies which affect the trans community when we look at health, when we looked at freedom of assembly, when we looked at gender markers, when we looked at availability of the things that we use as transgender and intersex identifying persons when we want to go to the clinic. We also wanted safe health care centers where we are not discriminated, where we actually go for STI screening, TB screening, HIV screening without facing any challenges. So this is what we are fighting for as Transmart. Actually, we are engaging with leaders of the community. So we are using chiefs to say, we go out there especially in the rural areas where we then go and meet with the chiefs. We sensitize them on transgender and intersex community. And then they are the ones who then say, no, what you are talking about, I think I have one or two people within my area who are like this. And then it's the chief and the religious leaders who then go and call those families with children who are transgender or intersex, and then they bring them to us. And also, we're trying to work with the National AIDS Council of Zimbabwe, who are into HIV programming and coordination. And we work with support groups of people living with HIV, where we actually have some of our members who are HIV positive, and we identify them, and then we start support groups. Yeah.
That sounds great, and it's beautiful that you are doing that. I read also somewhere that Transmart Trust manages a portfolio of projects targeting intersex and transgender persons who constitute intersex and transgender people living with HIV and albinism within urban and rural areas.
Yes.
Can we talk a bit about these projects?
Because of the COVID situation has affected everyone.
Yes, right.
We then started by sourcing food hampers for our members because they couldn't access food allocation from the government because their ID does not match the person who they are now because of the transformation they are going through. So we then sat down and say, what can we do as Transmart? And then we decided to start on projects where we are actually having our members making bags out of some materials. And then we have another project in the rural areas where we are actually into piggery. We started with 2 pigs, a female and a male, and then they gave birth to about 4 piglets. And now those piglets are also now in their, I think, 2nd month. They are also going to give birth to other piglets, and the project will go on like that. Then what we do is we take the older pigs and then we slaughter them, and then we sell the meat to butcheries within the area and to the community within the area. So they will use that money now to buy food and also to share some of the meat, and then they can go and use it at home. We have also started from the money that they get from selling. We have started some initiative of saying, if you are 10 people within that project, you then share money within yourselves. After a month, you then share the money, and then you can send your children to school. You can actually buy what you want, and even having money to go for medical help if they want to go for STI treatment, if they want to go for any other treatment at the hospital. Now they do have the money to do that, even to use money for transport to reach out to the health centers which are a bit far away.
That's awesome. So, speaking about transgender, can we define the term transgender?
Okay, so when you are now growing up, you were born in a man's body, and then you start to change. Like the people will just actually see that you are more on the female side. Even the things that you do, your hormones will then be more on the female side. and then you start to change, to transform. Like you now start to have, a female voice. You change your step, even the things that you want. The girls thing, you don't want to play with boys, you want to play with girls. We have two trans women who went for testing, and the doctors found out that their hormones were more to the female side. And you cannot do anything about that but to take hormone drugs to actually help you to go through the transitioning period.
Yeah, but after all you are saying, I can imagine that the people don't really understand what being a trans man or a trans woman means, isn't it?
In Zimbabwe, they didn't really understand what a trans person is. So what we did is we tried as much as possible, because normally they say it's a Western thing. You are taking the Western culture and bringing it to Africa, to Zimbabwe. So what we then did is we sensitized some doctors. Actually, when we are having our workshops, we bring in the doctors to talk about what it is for someone to be born a trans, what it is to be born an intersex person.
And how about hormone drugs? Do you have those?
Yeah, in Zimbabwe, we do have hormone drugs which are used on other, like when you are having your menopause, they will prescribe you hormone drugs. But when you go and say, I actually identify as a trans, can you please prescribe hormone drugs for me to actually go through my transitioning? They don't allow that.
Yeah, but it's funny because the Zimbabwean authorities said when it comes to trans rights, particularly in terms of healthcare, they do not discriminate. But this is a discrimination.
Yes. In Zimbabwe, we don't have. We are actually advocating for that, but we don't have. The trans-identifying people in Zimbabwe actually go to neighboring countries like South Africa, Zambia, if they want access to that. We don't have gender-affirming healthcare services in Zimbabwe.
That's a pity. I mean, that's sad.
Yeah. Like last year, we actually met with with about 75 parliamentarians and MPs, where we actually tabled this to them to say, we do have trans-identifying persons in Zimbabwe, and these are their challenges. And we would really like you to change some of the policies, which makes it so difficult for the trans community to actually access affirming healthcare services in Zimbabwe. And it's still a process, because we now have the National AIDS Council on our side actually helping us to have some of these policies changed.
Yeah, they have to be changed. I mean, hormones play often a crucial role in a transgender person's transition.
Yes.
So it's a human right.
Yeah, it's a human right issue. And but I think we are making progress, because last year we actually set in the Global Fund writing team, and I was in that writing team, where I actually said, no. You have been talking about sex workers, they have money. You have been talking about MSM, they have money. But I think it's now time you also include the transgender community to actually also get support from the Global Fund. And we actually got a 1-year support grant from Global Fund. And this year again, I went on and sit in the writing team, and we actually got a 3-year grant where transgender was considered to be a standalone key population.
That's great. So what propelled you to do this work in the first place?
Okay, so when I was at Kantari, I went to Chennai for my attachment. And when I was there, I was working with this organization, working with the transgender community. There's one called Nirangao, and the other one is called Sahodren. They work with the transgender community in Chennai. And when I was there, in India, the Indian women, they don't speak up.
Yeah.
But actually, when I was working in with these organizations, I managed to go and apply for some services for the trans women who were sex workers. Actually, afforded 8 of the trans women in Chennai to actually be employed by the hospitals there as cleaners, and that made me famous in Chennai. And I was actually called by one of the goddess, the big trans women who was regarded as a goddess in Tirupati, who then said, I'm giving you my blessings because you have shown that you really have passion to work and change the lives of the trans women in India.
That's beautiful.
And from there, my partner also was a was a trans woman.
Okay.
So I was so attached, and I really worked hard to make some changes. Most of the trans women in India, they depend on sex work, but I was actually trying to change that to say, okay, you are getting old, sometimes you get sick and you can't go and do sex work. What else can you do as a trans woman so that you keep on being able to take care of yourself? That is when we started having these small projects. We started some small projects where we went to Singapore. They went and buy some bags, some necklaces, and then they come back and sell. And it really worked, and it changed a lot of the trans women's lives. So when I come back to Zimbabwe in 2016, that's when I went to National AIDS Council and asked them, do we have trans identifying persons in Zimbabwe, not gays or lesbians, but trans and intersex identifying persons? And then we started with 5 trans women. We were coming to meet at my flat. And after that, we went on to be 15. And after 2 months, we were about 35 in Harare only. That's when we then decided to go out there in the rural areas and actually find out if we do have trans identifying persons in the rural areas. And we found out that there were so many. Hence, we started working with the chiefs and religious leaders to say, we want to really know whether you have trans identifying persons in your area.
Great.
And now we are working in 5 districts in Zimbabwe where we have established support groups with the help of the chiefs and the religious leaders.
That's great. So you said before that your partner or your couple is a trans man.
Yeah.
How is Agda for you to be together in Zimbabwe?
Yes. So my partner is in India. I'm the one who normally goes to India every year.
Okay.
It's only that last year I couldn't manage because of the COVID restrictions, but we are also planning to be together if the situation improves. So when they came to Africa, we actually went to meet in Durban, South Africa, because the situation in Zimbabwe, it's very difficult if you are a couple who identify as trans.
Okay, I see. So he doesn't know anything about the place where you were born, where you socialized, where you played as a little kid, anything at all?
Not yet. We were planning to do that. Actually, we were planning for them to come to Zimbabwe and also help with the organization Transmart, because they are also part of the board for Transmart.
I hope it works and I wish you all the best. What does inclusion and belonging mean to you as someone driving transgender awareness?
Okay, so to me, it's very important because, some of the issues that we are trying to fight for in Zimbabwe, like the gender marker, a lot of things, the trans community is left out because of the identity. And we also need that inclusion when we are at national level to say, can you include us as the trans identifying people when we are making policies which will also affect our lives? So it's one of the things that we are trying to push within the government and within the National AIDS Council and the Ministry of Health, the inclusion to say, don't speak on our behalf, don't discriminate us, but actually, can you involve us at national level so that we can also put our challenges on the table and see how we can work together to improve our lives, especially when we are looking at ending HIV by 2030.
Yeah, that's right. What is the most common stigma you have come across in your work?
Okay, so I'm saying we face a lot of stigma, especially when you identify as a transgender and you are also HIV positive. And in Zimbabwe, most of the community members take time to actually come out. Sometimes you are forced to marry with your family. You are a trans woman and your family force you to marry a woman because they don't want the community to know that you are like that. Like you have your family forcing you to marry because they don't want the society to know that you are a trans. There's a lot of gender-based violence which happens. You are forced to marry someone who doesn't love you, who is always abusing you, and you cannot go out of that situation or that marriage because you don't want to come out in the community. So it's some of the things that actually give a lot of stress to such an extent that you find some of the trans identifying persons committing suicide.
Yeah, that's a big issue. For most of us, work is stressful in and of itself. So carrying the added emotional weight of having to deny and suppress one of the most fundamental aspects of who you are, your gender identity, because it doesn't conform with society's norms regarding gender expression, I imagine is a hell of a life.
Yeah.
So what can we do to create a more trans-inclusive workspace?
Yeah, there's a lot of work which we have to do, especially looking at the situation that we have now, the COVID situation, where you really need to go and get your medication, and there's this total lockdown, and the clinics or hospitals which are trans friendly are closed, and you have to walk long distance where you meet law enforcement, police, soldiers on the road who will actually stop you and ask you your ID. You produce your ID, it's saying Mr. Vikram, and you look like a lady, you have your weave, you have your dress, and then they will actually say, what is this? Are you trying to impersonate someone? Or are you trying to run away from someone? And then they'll take you to the police station and start to interrogate you and even abuse you. Some of our members have been abused during the lockdown by the police and the soldiers to say, we want to correct you. You are saying you are a woman, but you are a man. Let us show you that you are a woman, or let us show you that you are a man. And they end up being abused sexually.
Yeah. Oh my God. It's really scary being a transgender in Zimbabwe.
Yes.
So what changes do you think are needed in society to make it possible for trans people to live their identity comfortably?
So there's a lot of sensitization which we really need to do, targeting the various ministries within the government, targeting the policymakers, targeting the health care providers to actually say, this is who we are. We cannot say we don't have the trans identifying people, and you need to differentiate between a trans, an intersex, a gay person, or a lesbian person. This is the entry point that we are using to say we really need to train doctors who will stand by us to say, no, 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 this is not by choice, but it's something which you cannot do anything about. And as much as you don't want to acknowledge it, but these people are there within the society, and they also need their rights to be respected, rights to education, rights to shelter, rights to food, rights to health. So we really have a long way to go. There's a lot of reaching out which we actually have to do and sensitize the policymakers and the chiefs and the society at large.
Gumisayi, as I said in the introduction, you were a participant in the 2015 Kantari Leadership Training course.
Yeah.
At the end of the course, you presented your dream speech in which you shared your plans for social change for prisoners who are HIV positive. The project was called Save Life. Now you are working with transgender. What happened with this idea of helping HIV positive prisoners?
Okay, so I'm still doing that. And as much as I'm now concentrating on the transgender and intersex community, I have one of the inmates who came out in 2014, who is actually running Zimbabwe Mighty Women of Hope now. But we still help each other here and there, where we are still going into prisons with donations. We are still going into prisons to start projects and also doing counseling sessions, especially to those who are HIV positive. But I think since 2019, we have not been able to go into prisons because of the COVID restrictions. So what we are normally doing now is just to send in donations of food because there's no food in the prison. And actually to give out like jerseys and blankets to some of our members who are in prison, especially those who are HIV positive and are also mentally challenged. But these days we are not allowed to go inside the prison. And for the project that I started at Kantari, the Save Life project, when I came back to Zimbabwe and I tried to start doing the project, there was a lot of resistance from the prison officers to say, we cannot give you inmates for such a long time because we wanted to make those kits which would carry people from their home to hospitals, especially in the rural areas. But to my surprise, you know what? Now that thing which I wanted to make with the inmates, I found out that there was someone who took the project and is now making those kits using those bikes, and it's all over town now. You can actually see those things. Yeah.
Ah, great.
But for me, I was so hurt because that was going to be a project which was going to save lives and actually give the inmates something to do while they were still inside, and also to try and have them mix with other inmates who would have finished serving their sentence, and also giving the opportunity for the inmates to actually come out and see their families. And no, it didn't happen like that.
Yeah, but still, somebody just started to do the same project, and somehow this save life idea is there. So your idea was to change society's mindsets about HIV positive people, mostly. Are we talking here about the same challenges we talked about, that HIV positive people are as stigmatized as LGBTQI?
Yes, the HIV positive people are still being stigmatized in Zimbabwe, especially from the people that we think they are the ones who are supposed to help us as HIV positive people. Like, take an example of myself. I'm now 50 years old. It has been 20 years now living with HIV. And sometimes when I contribute something, when we go out for workshops, I make a contribution, or when I don't agree with what the Minister of Health is saying, like giving us expired the ARVs and telling me that it's okay to take them because they've been extended, their lifespan has been extended. And then I say, no, I'm not going to take it. You'll find that people will say, no, don't mind this one. She has been taking ARVs for the past 20 years. The mind, the brains, they are full of ARVs, so don't listen to what she's saying.
Oh.
It hurts so much to say at this age and time, you still find people who stigmatize HIV positive people. And with the side effects, you are changed from this type of ARV to another type of ARV. And with my age, my system is getting old. Sometimes it doesn't work for me. Like last year, they switched us from Tenolam E to DTG, the new drug that we are now taking in Zimbabwe. It didn't get well with me, and I started having these side effects, a lot of side effects. And when I went back to the clinic where I take my medication, and even wrote an email to the Minister of Health to say, the drug that you introduced is causing this on me. They didn't believe me until I had to go to see a doctor at Parenyatwa, remove my clothes, and showed them that these are the side effects that I'm talking about. That is when they said, okay, we can switch you back to the medication that you were taking, the Tenolam E. But it took me about a month to convince the nurses and the doctors to say, can you please switch me off? Because my tummy was getting big. I was getting this uneven distribution of fat. I was getting these dark marks on my back. And there was a lot of pain in my feet. A lot of things were happening. So, and actually, like this time, we are talking about the COVID vaccination. I'm scared.
Yes, of course.
I have a lot of fear to say, if I take this vaccination and I have all these sort of side effects which was happening on me, and also like I'm someone who is going through my menopause period, what will happen to me? No one is listening to us as the aging people living with HIV.
So I can imagine living with HIV, it's not really a nice thing in Zimbabwe.
It's not.
You were also in prison.
Yes.
I said also in the very beginning. Can we talk about why you end up there? What happened?
Yeah, so I was working with an organization where I actually got the job through someone. I just have to say this. I was doing sex work, and I was going out with the director of a certain organization, who then gave me a position in the company. And when that director died, he has given me some offices to use. He has given me a kitchen where I was running a takeaway, like a restaurant.
Okay, yeah.
And one of the board members was a woman who also wanted to to be in a relationship with that director, but he was refusing because he was going out with me.
Oh,
So when the director then died, they then said, they just started saying, you were supposed to pay rent, you were supposed to do this, you owe us money, and then you actually made sure that your relatives benefited from the loans that were given out by the company. So they created a lot of stories, and the woman now, because she was linked to these CIOs within the government, they actually went to the police station where they were their relatives, and they just said, can you go and arrest this woman? She owes the company about $165. And then I refused to pay the money. But the magistrate and the prosecutor, they were told what to do on me. So they said, if you don't pay, we are going to lock you up. And then I said, no, go ahead, you can lock me up. That is how I ended up in prison.
This is a really harsh story. And I imagine having HIV, you were marginalized also a lot.
Yes, and I was also on TB medication. And I think they also arrested me just when I was coming from having lumbar punch. Things were not well with me those days. I was on TB medication. I was HIV positive. I just had lumbar punch. And there I was in prison, where even in prison, the prison officers also discriminated on me the moment I told them that I was HIV positive and I was on medication, on TB medication, to such an extent that I ended up having my own dress from home, my own plate, my own spoon, my own cup. My children had to bring me those things because no one wanted to share anything with me in prison.
I don't understand why the people react like that.
So, in Zimbabwean prisons, there's a lot of, it's overcrowded. You find that one cell, which is supposed to hold about 8 people, will end up with 30 people. You are pegged in one cell. And with TB, when you breathe the air, you can actually pass it to someone. I was sleeping at the toilet where there was this toilet. Just when we are entering the cell, I was not allowed to push to where other people were. I ended up my serving my time in prison sleeping near the toilet.
Oh my God.
Because I couldn't mix with other people because they were afraid I would pass HIV, I would pass TB to them. That was the worst nightmare. But I think that is what pushed me to start this support group in prison, where I actually went to the prison officer to say, I know there are a lot of people who are not coming out here at the female prison, but they are also HIV positive, because some of them have been coming to me to say, how do you manage to live and how do you manage to smell knowing that you are HIV positive? So we ended up sitting on a Saturday when we were not doing anything, and actually giving them information to say, no, when you are HIV positive, it doesn't mean you are dying. You can actually go on medication and you can be just like anyone else. So I think I had about 4 or 5 women who were HIV positive, but they were not taking medication in prison because of fear of being stigmatized. And they ended up now going to the clinic to say, when we came to prison, we were taking ARVs, but we stopped. So it actually helped other people to then come out to say, I'm HIV positive, I've been taking medication, but I stopped when I came to prison. That's how I started a support group at the Chukurubi female prison.
Listening to your story, I don't know actually really what to say. It's amazing how you have managed to stand up and to keep living with all these bad things that had happened in your life. So what tools or strategies have helped you to manage HIV for all these years?
Okay, so I think for me, it's my children. They've been the greatest pillar of my strength. My children knows about my HIV status. They support me to such an extent that if I cannot go and collect my medication, my son, who is 23 years old, actually goes and collects my medication for me. Even my daughter, when they are getting married, they actually tell their husband to say, my mother is HIV positive. Do you accept my mother? Or do you accept me with my HIV positive mother? And it has worked so well that my son-in-laws respect me very much. And even my children's friends, they respect me very much. I think for me, that was what made me to be what I am. And also coming out, coming out has worked well for me because I don't have to hide my medication. I always talk about HIV wherever I go. I talk about HIV because I want to save someone's life who is afraid of coming out to say, I'm HIV positive, and who are not even taking their medication, who are not even going out to get tested, but they are HIV positive. I've lost a lot of friends who would not face going out to get tested and get their results.
Yeah.
So I think that's something which have pushed me to be who I am today.
And that's amazing. But still, the stigma of HIV/AIDS still burdens many. How can we help to educate the general public and also create a sex-positive environment that is engaging for minorities to welcome their HIV-positive peers?
Okay, so normally what I do, I use myself as an example. There was a time when I was so down, I was bedridden, and people actually know me. They've seen me through that stage. And now when they look at me, I'm healthy, I've reached an undetectable viral load. It's now almost 20 years. People thought I was going to die in the 2002. People thought I was going to die. But now it's 2021. I'm healthy. If I don't talk about HIV, people will never notice that I'm HIV positive because I'm now healthy. I live a stress-free life. I do take my medication religiously. And this is the message that I go out with to people who are not ready to come out, or to people who are not yet ready to go and get tested.
I have no words, and if you could see me right now, you will see like there are some tears like going through my face. It's incredible. I'm really impressed, and thank you for your words. You are really amazing.
You know what? What really keeps me going is to know that I'm saving someone's life by talking about my own experience. That's really what makes me going.
Yeah, I think that's one of the best motivations one can have.
Yeah,
definitely. Gumisayi, we all know June is Pride Month. So what does this Pride Month mean to you?
Oh, I'm super excited. I'm really super excited. We actually got a vehicle from the Global Fund, which we are going to use to go into the rural areas and record lived-in realities of the transgender and intersex persons in the rural areas this Pride Month, to actually have them share their experience, especially this time with the COVID situation, because we have been having a lot of suicidal cases coming from the rural areas from the community. So we are actually now being able to go out. We have the Minister of Health giving us traveling letters to say even if there are roadblocks among the highways, we can then produce that letter to say we are going to have a program in this area, so they will let us go. So I'm super excited that we are going to reach out to more of our members who are in the rural areas this Pride Month.
That's awesome, Gumisayi. Thank you for sharing your story with us. Thanks for being a source of inspiration to many. I can only wish you all the best.
Thank you so much. It was nice talking to you as well. We, as the transgender and intersex community, we are looking for support so that we can have our own safe space where we can meet and be just being ourselves.
So, dear listeners, you've heard. If you are thinking about joining Gumisayi's cause, if you are thinking to cooperate, to help with them, or you just want some more information, have a look at our show notes. There you will find everything you need to get in touch with this incredible woman. Transgender, non-binary people and people with HIV are facing a rising tide of stigma, hateful rhetoric and violence. Not only in Zimbabwe, it is time for us to join together to voice our support and defend their rights. My guest today, Gumisayi Bonzo, is doing exactly that. And there we are at the end of the podcast to restore your faith in humanity. You'll find the stories of people sticking their necks out every Tuesday on Spotify, iTunes, our homepage, and every other place where you get your podcast. And if you subscribe, you don't have to look out for us. We'll be coming to you. Dear listeners, if there is a friend, a family member, an organization, or someone you know who is doing a great work in the community, someone sticking their neck out, just nominate them as a giraffe hero or tell us about them. Leave a comment, come and visit us at giraffe-hero.eu. My name is Jean-Pierre Aguiar Durañona, and I hope you join us also on our social media. We are on Facebook, Instagram, Twitter, and YouTube. But more importantly, I hope you join us again next week.
Stick Your Neck Out, the weekly podcast of the Giraffe Heroes Foundation.